Okay, hi Freddie, it's Dr. Buford here with Mitzi. We're just getting started on your right shoulder. We're looking in from the back to the front. I'm going to turn the brightness down just a shade here. And the first thing we're going to look at is your biceps tendon and the rotator cuff. Your biceps tendon's on the left side of that clear cannula. I've got a shaver sliding down. And now we can tug on the biceps anchor. Look down. We can see some cracking here. But we haven't yet decided what we're going to do. We're going to take away some of this torn rotator cuff tissue. Look to the, and here's the torn rotator cuff right here. Okay. So we're definitely going to be working on that today. Okay, let's look at the biceps. Look down. Okay, so as we look at the biceps, look over here to the left. Okay. Now, look down at 6 o'clock. As I tug on this, Freddie, I think that's going to be okay. Let's look up here. Let me see. We'll go off on the video and keep looking around here. Okay, so this is what we call a type 1 slap lesion, which means that we don't have to repair it. You can see a little bit of fraying, but when I pull up here, either way, that biceps isn't arching away from the glenoid. And so I don't think, I'm pulling pretty hard there. And it's not going anywhere. So pause, please. Okay, so we've identified the tear. Of it here. The yellow kind of color is exposed bone that we shouldn't normally see when the rotator cuff is not torn. The next step is to go ahead and take a spinal needle, and we'll check our angle to make sure we can get our suture anchors in at a good 45-degree angle. So here's our needle coming in. We're going to go a little bit more posterior. So it looks like we can get one anchor down here and likely have to get a second anchor up here. So we'll go ahead and make a little nick in the skin. And then we take an instrument that we call a punch. There it is coming down. This goes down into the joint. And so we want to make our first little suture anchor spot right about here. And into that hole that we made, we're going to screw down a metal. It's actually made out of titanium, a titanium metal suture anchor. There it is. Straight down into the hole. You can see that black line there. We're going to screw this down to that black line that's just below the surface of the bone, right about there. And then we're going to take a crochet hook. Sometimes there's these little bony fragments, and we just want to get rid of them so they don't get in the way. And then in just a minute, we're going to unload the screwdriver. Okay, so now we have all these fragments out of the way. And so now we'll unload the screwdriver. You can see there's 3 different colored sutures. We'll tug on it. That feels very solid. Next, we'll reach in. We're going to spread these apart and decide which suture goes with which and which order we're going to pass them in. There we go. So the white suture is farthest on the left, so we're going to reach in front here and grab that white suture, just like that. And then we're going to take our crochet hook and our suture hook, rather, which is coming in on the left side of the screen. You can see here, level. It's loaded with a black wire that we call a super shuttle. You can see it coming out of the tip right there. And so now what we're going to do is we're going to make sure we get the deep part of this tendon that's torn, like that. We're going to reduce it like this. We're going to come in and pass that hook down right through there. Okay? And then we'll go ahead and feed that. Pull tight on that, make sure I have it the way I want it. Perfect. Okay. Here then. And now we're going to load that black wire with the white suture outside your shoulder. Then as I slowly pull back, see how it brings that white suture, and then we'll come up, rotate your arm a little bit more. And push this in. Okay, we'll just pull that through like that. And then in just a minute, we'll reach in and get the partner suture. There's our crochet hook, and we know the partner suture is the white one. Now, to save ourselves a step, we're going to reach in and also retrieve the partner of the next suture that we're going to be working with. So we want this blue and white one here. And then we're going to reach in from the front and get the other blue and white one so it's coming out on the right side of the screen, like that. Okay, and now we're ready to pass our second stitch. So we'll rotate the eye, we'll give you a better look. We'll take a slightly different curved hook. There it is right there. Thank you. And now we're going to reach in and grab this deep layer of the cuff again. Like that. We'll reduce it like that. Look down at the... okay, so start here. We're going to pass this one right about here. There you can see us poking through. We'll go ahead and seed that. Okay, pause please. Okay, we're all done. It looks really good. We've got 2 triple loaded suture anchors in. There's our first set of 3 sutures from the first anchor. And then here's our second set of 3 sutures from the second anchor. And now we're going to go ahead and inject a little platelet-rich plasma. You can see also the yellow catheter. That's for the pain pump. But I'm happy with the way that looks. Everything moves together as a unit. That looks very secure. So we're going to finish up here and get you back to the recovery room. Good luck to you now. Bye-bye.